nephrology, we are doing a very important topic, that is the RAS, or which you call the Renin-Angiotensin-Aldosterone System. Renin-Angiotensin-Aldosterone System. What is the phenomena behind this? This is your glomeruli, the Bowman capsule. What exactly is happening? This is your afferent, this is your efferent, this is your Bowman capsule. When there is decreased blood supply to the kidney, decreased blood pressure, so what will happen? That will lead to decrease in GFR. So the afferent smooth cells of the afferent arteriole, they get modified to form JG cells, which is called juxtaglomerular cells. The smooth cells of the afferent, they get modified called juxtaglomerular cells, and these cells, when there is decrease in blood supply, blood pressure, what to the kidney, what they will do is they will produce renin. Renin is also produced by stimulation of the beta-1 receptors which are present in the kidney. So if you give beta blockers, they will block this, and hence this will be blocked. So if you want to control hypertension, you give beta blocker, they will block this, and hence renin will be blocked. So what exactly is this renin doing? That we need to know. So we are taking the first part of the RAS, that is the renin. Renin now, because of decreased blood supply to the kidney, is being produced, and what exactly it is doing? Your liver produces protein which is called Angiotensinogen. This Angiotensinogen is converted to Angiotensin 1. The conversion of Angiotensinogen to Angiotensin 1 requires your renin. So Angiotensin 1 is formed. This Angiotensin 1 is now converted to Angiotensin 2. This is done by angiotensin converting enzymes which come from the lung. Another function of this angiotensin converting enzyme is they also decrease the bradykinin. So anything which blocks the angiotensin converting enzymes will increase the bradykinin. Okay, so now angiotensin 2 is formed. Now this angiotensin will work on different aspects in the body to increase the pressure or the blood volume. So now the topic is shifted from renin, angiotensin to aldosterone. So we have reached angiotensin. Now what angiotensin is doing to produce the aldosterone? So so far we have made is angiotensin 2. This angiotensin 2 will work up on the hypothalamus. Secondly, it will work on the pituitary. Third, it will work on the adrenal cortex. Which region? Glomerulosa. Fourth, this angiotensin 2 will act on the proximal convoluted tubule. It will act on the efferent arteriole, and it will act on different blood vessels. this is your efferent arteriole, this is your efferent arteriole, and this is your PCT, proximal convoluted tubule. So it is acting on the PCT, it is also acting on the efferent arterioles and various blood vessels of the body. So what is this angiotensin doing on different parts is on hypothalamus. When angiotensin 2 works, thirst in the body is generated. When it works on the pituitary, it releases the stored ADH from the posterior pituitary. What does ADH do? ADH will make the aquaporin channels in the collecting tubule principal cells. Aquaporin channels in the collecting tubules to increase the absorption of water. Third, adrenal cortex. In the glomerulosa, when angiotensin 2 will work, it will produce aldosterone. And what is the aldosterone doing? It is doing is increase sodium absorption in the collecting tubules. PCT, proximal convoluted tubule, under the effect of angiotensin 2 will reabsorb more water, more bicarbs and sodium. So there is less volume of fluid in the body, that is causing decrease in the blood volume. Now this decreased blood volume is causing renin to produce angiotensin 2, and this angiotensin 2 is, what is it doing? It is absorbing water as well as bicarbonate. So what it is doing, this absorbing bicarbonate is doing, they are doing alkalosis. So this is called volume contraction alkalosis. Volume contraction alkalosis. Just remember, wherever the sodium will go, the water will follow. Efferent arterioles. Efferent arterioles, what it will do? It will constrict the efferent arterioles. If it will constrict the efferent arterioles, what will happen? If you constrict them, this pressure will increase, and hence GFR will increase and filtration fraction will increase. It will constrict the blood vessels to increase the blood pressure. Now there is a mechanism that whenever the pressure is increased, the message is sent to the brain, and the brain will stimulate the vagus to do bradycardia. But angiotensin 2 will prevent that also, that is, it will prevent the reflex bradycardia. It prevents the reflex bradycardia. So these are the important 6 mechanisms what angiotensin is doing. So renin is there, renin is coming from the kidney, converting the angiotensinogen to angiotensin 1, which is converted by angiotensin converting enzymes into angiotensin 2. So the second and third, by all these different mechanisms on the adrenal cortex, it produces aldosterone, which is the main hormone for your sodium absorption in the collecting tubule. And when sodium is increased, automatically water is increased in the body and volume is increased.